The nature of traditional medicine. Traditional medicine includes a diversity of health practices, approaches, knowledge, and beliefs incorporating plant, animal, and or mineral-based medicines, spiritual therapies, manual techniques, and exercises. Traditional medicine encompasses herbal medicine, diet and nutrition, hydrotherapy, massage and physical healing therapy, surgery, bone setting, spinal manipulation, psychotherapy, healing occultism, psychiatry, and preventive medicine. All these can be applied individually or in combination to maintain well being or to treat, diagnose, or prevent illnesses. Traditional medical knowledge may be passed on orally from generation to generation. A father who is a herbalist would usually raise a son or sons to take up the occupation after him. A mother who is a traditional midwife or birth attendant would also most likely take on her daughters as apprentices until she retires from practice and her daughters take over the role. Non family members can also be made apprentices who will graduate to practice independently. In some cases, families specialize in specific treatments, say, for instance, psychiatry or orthopedic medicine or midwifery, and the rest of the fields within traditional medicine, which we shall discuss later. Or it may be taught in officially recognized universities. The practice of traditional medicine is quite restricted geographically, although it may also be found in diverse regions of the world. However, in most cases, a medical system is called traditional when it is practiced within the country of origin, while it is referred to as alternative or complementary medicine when it is practiced outside of its traditional place of origin.